So, Lynn, if you could start by telling us maybe a bit about your background in nursing and where you've been based more recently because of the COVID situation.
Yeah, I'm a registered nurse. I left school to become a registered nurse and qualified in 1990. My background was then in theatres, high dependency nursing, and then I left sort of frontline nursing to become involved in nurse education, which I've done for about 15, 20 years. And I now work as a practice development nurse within NHS Greater Glasgow and Clyde Health Board. So I do a lot of teaching to nursing, midwives, and all the in-house training that we do within the health board for our staff. That's what my normal job is.
Yeah, but you've obviously over the last almost a year now, you've experienced seeing COVID a lot kind of closer quarters, I guess, than the rest of us. Has that been a difficult time for you?
It certainly brought different challenges. Our team have been asked to support clinical areas, or obviously any kind of education is a bit secondary when you're working in the health service. It's care of patients that is taking priority, and it's obviously always important. So we've actually been to support clinical areas more actively. So I've been working for probably on and off, but more or less last March in intensive care in the RAH. And working as a registered nurse there, just to help bolster the staff numbers and things to look after patients. So health has been challenging at different times. You're working in a frontline clinical area during all the COVID pandemic and lockdown and things like that. It's been challenging.
So as a healthcare professional on the front line, in terms of your experience of the vaccination rollout, have you had any experience of that? And what would you say to people who are maybe a bit concerned about the speed of the rollout or the different vaccines, all that kind of stuff at the moment?
So it's been really exciting to watch, actually, because some of the anaesthetists and medical staff that work in the intensive care unit have been actively involved in some of the trials. So they've been working part-time in intensive care and part-time in research. It's been really exciting to hear all the development right from the beginning of the development of the COVID vaccine. I was lucky enough to be in a frontline job that I got my COVID vaccine in the middle of December, and I've got a date for my second jab just at the end of this month. So I'm really excited about that, and I was very excited to get my sleeve rolled up. Part of my normal job is to be involved from a nursing perspective on the new things that are coming into healthcare. So I do have a bit of an insight into the processes about the ratification and the quality assurance around you're getting medicines approved and things like that. And the fact that I am assured that these things have been done in very quickly, but no corners have been cut, and as a result of the quickness, just because of the priority it's been given the time and the funding that normally is spread over several years. So I was delighted to be amongst some of the first staff to get my vaccine, and I can't wait for the rest of my family to be involved in getting their vaccine as well. And I'm encouraging everybody I know to go ahead and get the vaccine when they're on. It's the one way that we're going to get out of lockdown the quicker, is to make sure that we're protected from this horrible, horrible disease, which I've seen the worst effects from firsthand.
What can we pray for you personally just now? It's obviously been a difficult time for everybody, but there's particular pressures on frontline NHS staff. What can we pray for you and for your colleagues at this time?
I think I would love for people's strengthening prayers for resilience. I feel my resilience is low. It's been eaten away at. It's been over the last year. And I do feel that I need to build my resilience again. And that's to pray for. I think everybody that I know at work, we're all tired. And we need to know that people are doing their best to stay at home, get vaccine, stay safe, do all the fast things that Jason and Nicola tell us to do, because that's how we're going to get out of lockdown and get back to more of a normality.